Evening, Professor Rogden. I am recording my video, my 3 to 8 minute video, talking about the using external and internal analysis tools to identify my competitive advantage. I'm going to be reading off of my notes just to talk about the 3 major points that I want to make sure I hit on during this video to make sure that I discuss it for my entry. The first thing that I want to talk about is CESPET, and when I did further research, I found this stood for cultural, social, technological, economical, and political factors. And this is important because it's how we understand, especially in healthcare, the external environment that healthcare organizations operate in. From a cultural standpoint, which is the C and CESPET, one of the major strengths is going to be how a hospital system, it can focus on the mission, vision, values. That's something that we talk about a lot in your class. And it's not just about what you the words that you guys write about, it's how it actually gets lived out and that's a major point of the culture. And that's something that you can feel when you come into the hospital system, because things like a brand new building, that's something that other competitors have, but the actual feeling and the culture of a hospital, that's something that's unique to each healthcare system. Um, and culture is so important. We've especially learned this in the class because better culture can directly translate into better patient care. From the social aspect, um, it's from the social aspect, it's environment and access to resources. Economic is value-based care. Technology can be a strength and weakness. So think of AI can improve efficiency, but especially in the data-driven world that we're in right now, things like things like health information, personal health information leaks is a very big problem. So you want to make sure that that gets addressed. We want to make sure that we respect our patients and respect their profession, personal health, personal health records. And then another aspect what we want to make sure we touched on was the healthcare value chain. This is an internal opportunity. Um, so there's 3 different ways this gets set up in. There's the pre-service, which is everything that happens before the patient walks in. Then there's the point of service, which is when the patient is in the healthcare system. And then there's the after service billing, which is the follow-up, and that helps with the patient and it helps improve our outcomes. For me, when I was understanding the 3 different points, I thought it was extremely helpful that in our PowerPoint we got to see the breakdown of what constitutes in each one. So truly understanding how market research counts as pre-service, understanding exactly which goes into each one. So that helps me as a student visualize which thing actually goes in which category. Um, so for after service billing, I can truly see how after the patient leaves, billing, that's a follow-up. Um, Point of service, the marketing, the quality, especially value-based care, I understand that well. And then for pre-service, the branding. And then the last point I wanted to hit before I end my video was talking about the competitive advantage frameworks. And When I was learning about the competitive advantage frameworks, to me, it sound there were two different kinds. There's tangible and intangible. As a student, I like for things to be black and white, to be very clear. So I was able to understand the tangible, something that I can physically see, so like state of the art buildings, a desirable location, but the intangible are things that patients they can feel. So amazing culture, goodwill, strong reputation. Those are things that patients know or the staff know. They just know about the healthcare system. And that's things that, we can't measure, those are still very important. That's a competitive advantage. And throughout the PowerPoint, we were given a chart of no competitive advantage, short-term competitive advantage, and long-term competitive advantage. Out of the three, we want to position ourselves in a healthcare system that has long-term competitive advantage. This means that what we have is difficult for the competitors to replicate, and that it means it can be sustained for a long term for the healthcare organization. It is of high value, it has rare strength, it has the strength is difficult to imitate, which is important, and then the strength can be sustained. We look for all of those. So high value, rare strength, difficult to imitate, and then sustainable. We want to make sure that all those are checked for it to be a long-term competitive advantage. If one of those are not checked, then either means it will not be a competitive advantage or it'll be short term. I really enjoyed this lesson, even though we didn't have class this week. It was pretty interesting. But yeah, thank you so much for listening to my video.